Hello, my name's Dr. Miguel Stanley. I'm a dental surgeon and I'd like to talk to you about the No Half Smiles philosophy that I developed well over a decade ago to help dentists avoid complications with their patients. Picture a triangle and the No Half Smiles philosophy is the center of this triangle. On one of the angles, we have the problems that a patient presents, which are clinical, emotional, and financial. I prefer to lose the patient for the right reasons rather than the wrong ones. Let me explain that. I prefer to lose a patient because they cannot afford the correct treatment to the gold standard levels of dentistry than for doing something cheap and fast just so the patient can afford it, only to a few years later have even worse problems in their mouth. On the second angle, we have the treatment perspective, which I like to call the golden rule of treatment, which is the cosmetic side of the treatment, the functional side of the treatment, and most importantly, the biological side of the treatment. And as dentists, we need to focus first and primarily on the biology, eliminating disease from the mouth. And only after we treat the function, which allows us to chew properly, and last but not least, the smile, the cosmetics. That discussion needs to be won in the very first appointment, where we understand the difference between what the patient wants and what the patient needs. As dentists, we need to focus on what the patient needs. And on the third and final angle, you have the 3 dimensions of excellence that a dentist will put into play: their experience, the materials they use, and the time that they use to do each treatment. Managing these 3 basic rules will define a global success as a practitioner and, of course, a successful outcome for your patients.